Imagine waking up and instantly seeing the details of the world around you without having to depend on glasses or contacts. With LASIK refractive surgery, this dream can become a reality for those who are nearsighted, farsighted, or have astigmatism. LASIK isn't what it used to be. Diagnostic techniques have advanced dramatically over the years, and the surgical technology is now more precise than ever before. During the procedure, a laser is used to reshape the cornea, where light enters the eye. This corrects vision by changing the cornea's shape so that light is properly focused. The procedure takes only minutes, and most people can go to work the next day. As with any surgery, there are risks and limitations, and our team of LASIK specialists can review these with you. Waking up with clear, sharp vision is priceless. It's no secret that the cost of glasses, contact lenses, and solution can add up over the years, making LASIK a smart investment. Laser vision correction can change the way you see the world. Find out if it's an option for you by asking our team of LASIK specialists today.
O LASIK pode ser muito bem sucedido quando realizado nos pacientes apropriados, mas não se trata de algo para qualquer pessoa. Em geral, bons candidatos devem ser de certa idade, devem ter tido uma receita de óculos ou lentes estável durante os últimos 12 meses, além de um erro refrativo diagnosticado e olhos saudáveis. Se você estiver interessado nessa intervenção, deve ir ao médico para determinar se o LASIK é ou não uma opção segura e viável para melhorar a sua visão. Essa decisão será baseada numa série especial de testes, bem como num histórico médico detalhado.
Corneal topography is the latest technology to ensure precise analysis of your cornea. It is used for advanced contact lens fittings, refractive surgery, and for diagnosing, monitoring, and treating various eye conditions. The cornea is the clear outer surface window of the eye. It transmits and focuses light into the eye and plays a major role in how you see. Corneal topography creates a 3D map of the curvature of the cornea. Just as the Earth appears to be a perfectly smooth sphere from outer space, the cornea looks like a perfect curve to the naked eye. However, a closer inspection reveals that some parts are steep and others flat. Using corneal topography, your doctor can closely inspect and map the valleys and hills that characterize your cornea's shape. This sort of 3D map allows for the detection of conditions that would be invisible with conventional testing. During the test, rings of light are projected onto the cornea, and measurements are taken of your eye's surface. This test is non-invasive. There are no drops, there is no contact with the eye, and no puff of air to worry about. Your doctor will use the computer-generated map to create a custom, precise treatment for your eye health and vision needs. For example, if a contact lens is too tight, it could constrict normal tear flow, or if too loose, it could cause excessive movement and damage the corneal tissue. Corneal topography helps your eye care professional identify your unique corneal shape and find the best solution for you. Corneal topography is the latest technology to ensure precise analysis of your cornea. It is used for advanced contact lens fittings, refractive surgery, and for diagnosing, monitoring, and treating various eye conditions. The cornea is the clear outer surface window of the eye. It transmits and focuses light into the eye and plays a major role in how you see. Corneal topography creates a 3D map of the curvature of the cornea. Just as the Earth appears to be a perfectly smooth sphere from outer space, the cornea looks like a perfect curve to the naked eye. However, a closer inspection reveals that some parts are steep and others flat. Using corneal topography, your doctor can closely inspect and map the valleys and hills that characterize your cornea's shape. This sort of 3D map allows for the detection of conditions that would be invisible with conventional testing. During the test, rings of light are projected onto the cornea, and measurements are taken of your eye's surface. This test is non-invasive. There are no drops, there is no contact with the eye, and no puff of air to worry about. Your doctor will use the computer-generated map to create a custom, precise treatment for your eye health and vision needs. For example, if a contact lens is too tight, it could constrict normal tear flow, or if too loose, it could cause excessive movement and damage the corneal tissue. Corneal topography helps your eye care professional identify your unique corneal shape and find the best solution for you. LASIK and PRK are common laser vision correction procedures, but they differ slightly. Usually, patients are first considered for LASIK surgery. If they are not a good candidate for LASIK, then PRK may be an option. Both procedures correct vision using targeted laser therapy. However, the procedure and recovery processes differ. To be a candidate for LASIK surgery, the patient's corneas must be thick enough. If the cornea is too thin, LASIK can weaken its structure, causing the cornea to bulge. This can result in decreased vision. PRK may be a better choice for some patients with thin corneas because the laser does not penetrate as deeply into the cornea as with LASIK. In LASIK surgery, the doctor creates a corneal flap, which is folded back as the laser is applied to the deeper corneal layers. After the laser treatment, the flap is repositioned over the eye. In PRK, there is no flap. Instead, the surgeon removes the outer corneal surface completely to expose the deeper corneal layers where the laser is applied. The deeper layers are left exposed. Eye drops, oral medication, or a protective bandage contact lens may be prescribed to manage discomfort while the outer layer regrows. Because of the time it takes the cornea to heal, patients may experience more discomfort and longer recovery with PRK compared to LASIK. Additionally, PRK patients may have more frequent follow-up visits with an eye doctor to monitor the eye's healing after surgery. Both LASIK and PRK are popular options for correcting refractive errors. The best treatment type depends on your unique needs. Let us know if you have questions about your options for laser vision correction. When you enter the room where your LASIK surgery will be performed, you will begin by lying down on the procedure bed. Next, anesthetic drops are applied to numb your eyes. The surgeon will then position you properly under the laser machine. A device will hold your eyelids open so that you do not have to worry about blinking or closing your eye during the procedure. The LASIK procedure consists of 2 steps. The first step is creating the flap. To do so, your doctor will separate the outer layer of the cornea, the clear front window of the eye. Your doctor will then gently lift this flap and hinge it back out of the way in order to expose the deeper layers of the cornea. At this point, you may feel some mild pressure over the eye and your vision may dim and become blurry. The second step is performed by a laser that will reshape the cornea for your specific prescription. You might see a blinking, fuzzy light. Your doctor will ask you to look straight ahead in order to precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. The laser light is invisible, but you will hear a slight clicking sound as the laser gently reshapes your cornea. Because your eye will be numb, you will not feel the laser, although it is normal to smell a faint odor at this point. Before you know it, your procedure will be over, and the surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time. You will receive a shield or sunglasses to cover your eyes so that you do not accidentally rub them. Ask us if you have any questions about the LASIK procedure. LASIK surgery begins with you entering the laser room and lying down in a relaxed position on the procedure bed. Next, anesthetic drops are applied to numb your eye. The surgeon will then position you properly under the laser machine. A painless lid-separating device will keep you from having to worry about blinking or closing your eye during the procedure. Next, your doctor creates an ultra-thin flap in the cornea using computer-controlled laser pulses, which pass through the top layers of the cornea to form microscopic bubbles at the optimum depth and position, gently separating the outer layer of the cornea from the layer being treated. Your doctor will then gently lift this flap and hinge it back out of the way. You'll be asked to fixate on a blinking fuzzy red light, and your doctor will precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Painlessly, computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. Before you know it, your procedure is over, and the surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time.
Seus olhos e sua visão são tão especificamente seus quanto suas impressões digitais, não havendo duas pessoas iguais. Mesmo assim, até recentemente, duas pessoas cujos diagnósticos indicavam a mesma receita de lentes eram tratadas da mesma maneira. Isso se devia a que os óculos, lentes de contato e a cirurgia convencional com laser só se referem a problemas conhecidos por aberrações de categoria menor, o que abarcava condições como a miopia, hiperopia e astigmatismo. sem incluir as chamadas aberrações de categoria maior, que são específicas de cada olho. As aberrações de categoria maior podem resultar em sintomas visuais como auras, pontos luminosos e brilho, sendo comum causar problemas ao dirigir, principalmente à noite. Atualmente, uma nova forma de correção da visão, com emprego de laser conhecido por wavefront ou laser sob medida, leva em consideração as aberrações de categoria menor e também as de categoria maior, oferecendo um tratamento com base na impressão digital exclusiva de cada olho. Além de corrigir as aberrações de categoria menor, o procedimento de laser sob medida pode ajudar a melhorar a satisfação do paciente com a sua visão noturna mediante a redução do risco de auras, pontos luminosos e as chamadas imagens fantasma.
Uma forma avançada de personalizar o Lasik, conhecida como Lasik personalizado guiado por aberrometria, ajuda a otimizar a velocidade, a precisão e a segurança do seu procedimento. E é projetada para proporcionar a melhor visão possível de dia e de noite. Diferente de outras formas, o Lasik personalizado guiado por aberrometria trata as áreas externas da córnea de forma a preservar sua curvatura natural. Isso ajuda a prevenir uma distorção conhecida como aberração esférica e minimiza o risco de aparecerem halos, pontos de luz, clarões e outros problemas de visão noturna. O melhor padrão do tratamento a laser para seu olho é definido por um sofisticado programa de computador e se baseia em medidas detalhadas que foram aferidas durante seus exames pré-operatórios. Lasik guiado por aberrometria pode fazer mais para melhorar sua visão. Pode realçar sua vida.
LASIK is a popular procedure with very high success rates. Most people see positive results from LASIK surgery quickly. But every person responds differently. Your vision may not be perfect immediately following the procedure, and total healing occurs over many weeks and even months, and usually takes longer for farsighted patients. It's normal to have blurriness, light sensitivity, tearing, and mild discomfort right after surgery. Additionally, one of your eyes could heal faster than the other. There is still some time before your laser vision correction surgery, but these instructions will ensure that your procedure goes as smoothly as possible. Grab your glasses, you'll need them. Your doctor may recommend you stop wearing contact lenses in the weeks leading up to your surgery because they can affect the shape of your cornea or affect the results of any measurements. Be sure to pick up your post-operative eye drops from your pharmacy before your procedure and apply drops as instructed. Also, make sure to coordinate a ride home from the procedure because you will not be able to drive yourself. On the day of your surgery, be sure to double-check the surgical center's address. This location might not be where your consultation took place. It's also important to arrive about 10 minutes before your appointment and bring all necessary paperwork, including your consent forms. It's safe and even recommended to eat and take regular medication the day of your surgery. You should come to the appointment in comfortable clothing. Do not wear any makeup, perfume, lotion, or hair products which could interfere with the laser. Remember to bring sunglasses. In some cases, sun protection may be provided, but having a pair of your own sunglasses is handy. Your eyes may be sensitive to light after the procedure. Following these instructions will reduce the risk of having to reschedule the procedure. In the meantime, if you have any questions, please give us a call. After the LASIK procedure, you'll usually be able to go home within a few minutes, though you'll need someone to drive you. It is normal for one eye to feel different from the other and to notice red spots on the white part of your eye. Occasionally, people see some vision improvement immediately after the procedure, but it is common to experience blurry or hazy vision for the rest of the day. Nearsighted patients and those with astigmatism usually notice considerable improvement the very next day. But visual recovery may take longer for farsighted patients. In all cases, vision continues to gradually improve for days and weeks after the procedure. Plan to stay home and take it easy for the remainder of the day. If you have itching, burning, or a feeling of sand in the eyes, closing your eyes for a time can help. If your eyes are sensitive to light after the procedure, you should wear sunglasses during your recovery. Most people are able to go to work and resume normal activities the next day, but if necessary, you may need some extra days of rest. You will probably be asked to avoid swimming for at least a couple of weeks after your procedure. Though you can generally bathe, shower, or wash your hair beginning the next day, you should try to avoid getting water directly in the eye. But if some does get in, dab lightly to dry and do not rub. In fact, it is important not to rub the eye for a month or so after your procedure, as there is a small chance of dislodging the corneal flap. Your doctor may advise you to avoid working in a dusty or dirty area, or avoiding wearing eye makeup for a period of time after your procedure. Generally, you will return to see your doctor or surgeon the day after surgery for a follow-up exam. As with any other surgery, always follow your doctor's instructions and take any medication prescribed. It's important to attend follow-up appointments and routine eye exams as advised so that your doctor can monitor the healing process. If you have questions about what to expect following LASIK surgery, don't hesitate to ask us.